Look, none of us want to talk about this, but the truth is, fellas, ignoring your prostate won't make it go away. So, in the interest of keeping things brief and avoiding any unnecessary trips to the urologist, let's talk about the early warning signs of prostate cancer. We're going to use some humor, because frankly, the alternative is just too damn depressing. We're here to make sure your prostate doesn't do the same. Alright, let's start with the most common and arguably most annoying early sign of a potential prostate problem. Your bladder suddenly developing the attention span of a goldfish. It's like your bladder has decided to become the most forgetful organ in your body. We're talking frequent trips to the bathroom, especially at night. You might find yourself waking up multiple times, disrupting your sleep, and leaving you feeling exhausted the next day. And no, watching Jaws before bed doesn't count as a valid excuse. It's not the movie, it's your bladder playing tricks on you. You know it's bad when you start envying women and their magical ability to hold it for ever. It's like they have some secret superpower that you desperately wish you had. And speaking of holding it, if you find yourself struggling to even get started, or you dribble more than a toddler with a juice box, that's another red flag. It's frustrating and can be quite embarrassing. Then there's the feeling that you've never quite finished peeing, like your bladder's playing a never-ending game of just kidding. You think you're done, but nope, back to the bathroom you go. And if peeing starts to feel less like a relief and more like a scene from a low-budget horror film, with burning, stinging, or pain, well, that's your cue to phone a friend. Don't ignore these symptoms. They're your body's way of telling you something's not right. Seriously, guys, your urinary tract should not be mistaken for a fire-breathing dragon. If it feels like you're peeing fire, it's time to get checked out. Remember, your bladder is not a nightclub. It shouldn't be open 24/7. It needs its rest too, just like you do. So if you're experiencing any of these symptoms, don't hesitate to seek medical advice. Number 2. Okay, let's move on to something a little less common, but infinitely more terrifying: blood. We're talking about seeing blood in your urine or semen. Yes, it sounds alarming, and it can be. Now I know what you're thinking. This is supposed to be the humorous part, and you're right. But there's nothing funny about ignoring potential warning signs, especially when it comes to your health. So let's be clear. Seeing blood where it doesn't belong is never a good thing. It's a signal from your body that something might be wrong. It's like finding a spider in your bathtub. Sure, it might be harmless, but it's still going to make you scream like a small child, and rightly so. Now, before you panic and assume the worst, there are a few benign reasons why you might see a little blood in your urine. Maybe you went for a particularly vigorous jog, or perhaps you overdid it on the spicy tacos the night before. Both can cause minor irritation. But if it persists, or if you see a significant amount of blood, or if it's accompanied by any of the other symptoms we've discussed, then it's time to channel your inner hypochondriac and get thee to a doctor. Remember, guys, when it comes to your health, it's always better to err on the side of caution. Don't wait for things to get worse. So if you see blood in your urine or semen, don't ignore it. Take action, consult a healthcare professional, and ensure you're taking care of your body. Number 3. The little buddy takes a break: erectile dysfunction. Alright, let's talk about something that strikes fear into the hearts of men everywhere. Erectile dysfunction. Yes, we're going there. It's a topic that many shy away from, but it's crucial to bring it into the open. Because as uncomfortable as it is to discuss, it's important to remember that ED can sometimes be a sign of something more serious, like prostate problems. Ignoring it won't make it go away. So, let's be blunt. If your little buddy isn't performing up to par, it could be a sign of a prostate issue. It's not just about performance, it's about your overall health. Now, before you start stockpiling Viagra and hiding your browser history, let's be clear. ED can be caused by a whole host of things, like stress, anxiety, medication, or even just having one too many beers. It's not always a straightforward issue, but if it's a persistent problem, or if it's accompanied by any of the other symptoms we've discussed, then it's time to have a chat with your doctor. Look, I get it. It's not an easy conversation to have. Talking about your erectile dysfunction is about as much fun as a root canal, but it's important, guys. Your health and well-being are worth the discomfort of that conversation. So if you're experiencing ED, don't suffer in silence. Reach out, get the help you need, and take control of your health. It's a step towards a better, healthier you. Number 4, not so fun fact pain. Welcome back to our prostate-themed party. I'm your host, Bruce Health, and today's topic is pain. Yes, pain. Now, I'm not talking about the kind of pain you get from stubbing your toe or biting your tongue. This is a whole different beast. We're talking about persistent pain in your pelvic region, lower back, hips, or even your bones. It's the kind of pain that makes you want to curl up in a ball and whimper. Now, I'm not saying that every ache and pain is a sign of prostate cancer, but if you're experiencing persistent pain, especially in the areas I mentioned, it's definitely worth getting checked out. Because here's the thing about prostate cancer, it's a sneaky thing. If you're in pain, go see a doctor. Number 5, general malaise. When your body's just not feeling right. All right, we're in the home stretch now, folks. We've covered the leaky faucets, the unexpected bloodstains, the flaccid flags of surrender. But what about the more general signs that something's just not right? You know the feeling. You're constantly tired, even though you're getting enough sleep. You've lost weight, but you haven't changed your diet or exercise routine. You just feel off. Now, I'm not saying that every time you feel tired or lose your appetite, it's prostate cancer. But if you're experiencing these symptoms, especially in conjunction with any of the other delightful signs we've discussed, it's definitely worth getting checked out. So pay attention to your body. If something feels off, don't ignore it. Final thoughts. Don't be a stranger, get thee to a doctor. Look, I know we've had some laughs today, but on a serious note, prostate cancer is a big deal. It's the second most common cancer in men worldwide, and it can be deadly if it's not caught early. But here's the good news. Prostate cancer is also highly treatable, especially when it's detected in its early stages. That's why it's so important to be aware of the signs and symptoms, and to see a doctor if you experience any of them. So, there you have it, gentlemen. A crash course in prostate health, brought to you by a comedian and a singer. But seriously, if you're concerned about your prostate, go see a doctor. It could save your life. Thanks for watching. Don't forget to like and subscribe, and we hope to see you again in the next video.